Let's start by breaking down the word neurofibromatosis. Neuro refers to nerves. Fibroma refers to tumors that arise from nerve tissue. And ptosis refers to a condition. So neurofibromatosis is essentially a condition where tumors develop along nerves. In this video, we're focusing specifically on neurofibromatosis type 1, also known as NF1. NF1 is a genetic condition that occurs in about 1 in every 2,500 births. It affects people of all populations, genders, and ethnicities equally. Around 50% of individuals with NF1 have a learning disability, and at this time, there is no cure. Neurofibromatosis type 1 is a genetic disorder that causes tumors to develop along nerves. It is considered a tumor predisposition syndrome, meaning patients have an increased risk of developing certain tumors. NF1 is also a multisystem disease, affecting multiple parts of the body including the skin, nervous system, eyes, and bones. NF1 occurs due to a mutation in the NF1 gene located on chromosome 17. This gene produces a protein called neurofibromin. Neurofibromin plays an important role in controlling cell growth. When this gene is mutated, neurofibromin does not function properly. Let's take a look at the pathophysiology. Over here on the left, we have the normal situation. The NF1 gene produces a protein called neurofibromin, which acts as a tumor suppressor. Neurofibromin helps regulate the RAS signaling pathway, keeping cell growth under control. Now, over here on the right is what happens in neurofibromatosis type 1. Because of a mutation in the NF1 gene, neurofibromin is lost or non-functional. Without that regulation, RAS signaling becomes overactive, which leads to increased cell proliferation. Over time, this uncontrolled growth results in the development of neurofibromas and other tumors along nerves. Inheritance. Neurofibromatosis type 1 follows an autosomal dominant inheritance pattern, meaning a parent with NF1 has a 50% chance of passing the mutation to their child. However, about half of NF1 cases occur due to new or spontaneous mutations, meaning there may be no family history of the condition. Clinical features of NF1 can vary widely, but there are several key findings to recognize. Café-au-lait spots are light brown skin patches, and having 6 or more, typically greater than 5 millimeters in children or 15 millimeters in adults, is a classic finding. Axillary or inguinal freckling may also be present. Neurofibromas are benign nerve sheath tumors that can develop on or under the skin, and in some cases, deeper plexiform types can grow larger and involve surrounding structures. Scoliosis is a curvature of the spine that can occur, often during periods of rapid growth, especially in childhood or adolescence. Cognitive differences occur in about 50% of patients, usually presenting as learning difficulties, while overall intelligence is often within the normal range. Head size, or macrocephaly, is common and typically not clinically significant. Delayed or early puberty can occur, sometimes related to underlying optic pathway tumors. Small stature may be seen, but usually does not cause significant health concerns. Optic glioma is a tumor of the optic nerve, occurring in about 15% of children, most commonly before age 6, and can affect vision. Bone issues can include skeletal abnormalities, such as tibial bowing or other bone defects, sometimes present early in life. Diagnosis of NF1 is clinical and requires 2 or more characteristic findings. These include 6 or more café-au-lait spots, axillary or inguinal freckling, 2 or more neurofibromas, or 1 plexiform neurofibroma, optic gliomas, 2 or more Lisch nodules, osseous lesions, a known NF1 mutation, or a first-degree relative with NF1. Genetic testing is available and can help confirm a genetic diagnosis, especially in younger patients who don't yet meet full clinical criteria. However, it does not predict disease severity. Management of NF1 focuses on lifelong monitoring, as there is no cure. Patients require regular, multi-specialty follow-up to identify complications early. Treatment is primarily symptom-based, Surgical intervention may be used in select cases, and targeted therapy with MEK inhibitors, such as selumetinib, can be used for inoperable plexiform neurofibromas. Symptom management includes pain control, support for learning or behavioral challenges, routine vision monitoring for optic gliomas, and orthopedic care for bone deformities. Thanks for watching. If you found this helpful, don't forget to subscribe to my channel. Let me know in the comments what you'd like to see next. And as always, this content is for educational purposes only and is not medical advice. Please consult your healthcare provider for any personal medical concerns.